There is a fine balance between health concerns and stigma when it comes to COVID-19 vaccine priorities and obesity. Obesity expert Dr. Sean Wharton joins us now with more. Good morning. Thanks for joining us.
Morning, absolutely.
So there was a lot of stigma and a lot of reluctance, I understand, from people who met a certain BMI, body mass index, from coming forward to get their vaccines when they were prioritized because of the stigma. They didn't want to be known as just being obese, and that's why I'm getting my shot.
Right. So there was a concern there, certainly. And we know that this patient population is at a higher risk. They're at a higher risk of getting COVID, higher risk of going into the hospital, and higher risk of dying from it. So therefore, they should be at a priority list. But there was some hesitation. They were concerned that they were going to be labeled as you have a character flaw. That's why your weight's high, and now you're getting a priority for the COVID vaccine. But they really should.
Right. And there's so much stigma because obesity is not caused necessarily by just sitting around on a couch and just eating all you want. There are so many factors. Poverty is a huge thing for obesity.
Right. So those are the social determinants of health, certainly poverty and the environmental challenges. So we see the highest rate of elevated weight in the Indigenous population. And of course, they end up being the worst treated. So there's racialization, there's marginalization, their immigrant population have a major challenge, but there is a genetic predisposition, and that's the major challenge. But the good news is there's actually treatment, effective treatment for decreasing weight in a very real medical manner.
Mm-hmm. And you deal with it medically. You're not you're not a get thin quick kind of doctor, because being thin doesn't necessarily mean that you're healthy either.
Right. So the weight that is the challenge is the central weight. So even if you have a BMI or body mass index, as we talked about, that is lower, but you do have some extra weight, and it's in that central area within the stomach. That is the inflammation that goes to the heart, it goes to other organs, it goes to the lungs, and it may even promote the COVID virus to actually attach to the lungs more so. So we know that it's where the location is of the fat that causes the inflammatory condition and the real sickness. But overall, people do want to be healthier, and that sometimes means decreasing weight. And there is effective treatment well beyond exercise and diet. Those are standards. We have to do that. But there's medical intervention that are very effective at getting the weight down.
Mm-hmm. And that's what you deal with as an internal medical doctor. So what kind of things do you use in your practice?
Right. So the three main treatments is psychological intervention. So that's cognitive behavioral therapy. So somebody understanding how their coping mechanisms are and their strategies and why they use food as a soothing aspect after work and a number of other things. People usually can't eat well in the evening. They say, I can eat fine during the day, doc. It's my evening eating. And there's a reason for that. It's a cognitive behavioral type of aspect. Medications are now effective. Just the way medications work for high blood pressure or high cholesterol, they now work to bring down weight effectively, really effectively. And then finally, for the people who are at that higher end, then we have bariatric surgery.
Okay, but it's not a factor of, lose weight and then get the shot. It's like get the shot now.
Absolutely, yes. So that's what we know, is that if you are at higher risk and the weight is elevated now, today, get that shot because it'll decrease your risk of getting it, decrease your risk of being sick when you actually get it. So you are at higher risk now, and then over the long term, work on getting the weight down so that risk goes down and down.
And how did that study even come out, that they found out, the World Health Organization found out that like you're 3 times more likely if you're obese to get serious ramifications?
Yeah, so this is interesting. We now have a lot of data because this COVID-19 is affecting the world. So all you do is you grab all of that data, WHO has it, and we look at who is in the intensive care unit more, who goes to the hospital and then is in the emergency department, but makes it into the hospital and is needing actual oxygen. So we know that older patients.
Thank you, Dr. Wharton. I'm going to have to cut you off there, but we'll get your information up on chch.com. Thanks for joining us today.
Absolutely. No.